This is Dr. Sonia Dhoot, and you are watching this video because you have floaters that are impacting your quality of vision. Floaters are something that are very, very common as we get older, and luckily, most of the time, floaters are something that we can ignore and our brain learns to adjust to over time. Unfortunately, however, some floaters are very difficult to ignore and can interfere with our ability to read or drive or do things we like to do on a daily basis. Those are usually floaters that can present as a blurry or blind spot in the center of the vision, and no matter how much you try to blink them out of the way, they seem to be right there in the middle. If you can live with the floaters, we prefer that, but if they've been there for a few months and they're still very bothersome to you, surgery is something that is an option nowadays. Years ago, surgery used to be much more invasive and was not something that we used to do for floaters. However, surgery is much quicker and safer and less invasive than it used to be. The surgery for the floaters is an outpatient surgery, and it takes about 10 minutes. You come into the surgery center, we do the surgery, and you go home the same day. The surgery, we make 3 little incisions on the white part of the eye about the size of the tip of that pen. The first incision is for a infusion cannula that keeps the eye inflated while we work. The second cannula is a light pipe that gives us direct visualization of the retina. And the third is an instrument called a vitrector that actually cuts up and removes the vitreous jelly in the back of the eye. That is where your floaters live. So we remove the vitreous jelly and we replace it with saline. Your floater should never come back once that jelly is gone. The jelly actually is not something that we need to live with, and lots of people are walking around with just fluid in the back of their eye. The biggest risk of doing floater surgery is the risk of retinal detachment, bleeding, and infection. The chance of all 3 of those happening together is about 1%. So 99% chance we'd be able to get rid of the floaters and not have any unwanted side effects. I would say patients that are so bothered by the floaters are usually very, very happy. Not only are the floaters gone, but oftentimes contrast sensitivity and visual acuity actually improves after floater removal as well. If you have not yet had cataract surgery, then doing this surgery will accelerate the growth of the cataract. That's not really a huge deal because eventually you live long enough and everyone needs cataract surgery. But the average for all people after retina surgery is about 9 months later that they need cataract surgery. Some people it's a few months and some people it's a few years, just kind of depending on how bad your cataracts are going into the surgery. There is also a laser that is available at some practices to get rid of floaters. The laser does not work as well as the surgery, and so I personally do not offer it to my patients. The laser is a very difficult thing to aim in the vitreous jelly because it's not a focal point, it's a big jelly area, and so the chances of damaging either your retina or lens are much higher. And the laser doesn't actually get rid of the floaters. It breaks up your big floater into tons of tiny little ones, and so it doesn't actually get rid of them. So a lot of patients, will look online and notice, oh, can I have a laser? It sounds like it's easier, but the surgery is actually more effective and safer. And so for that reason, I tell patients you either live with the floaters or do the surgery.